Support for Consider This is provided by the University of Nebraska at Omaha College of Communication, Fine Arts, and Media.
Once again, from the studios of UNO Television on the campus of the University of Nebraska at Omaha, Consider This, a program of issues and information behind today's news.
Now? Can I at least put my shoes on?
If your bladder is calling the shots, you may have a medical condition called overactive bladder, or OAB.
Gotta be kidding me. I've had enough. It's time to talk to the doctor.
And with that, we will start the conversation. Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, bladder health. Joining us to talk more about it is Dr. Rebecca McCrary, board certified in obstetrics and gynecology. She is with adult pediatric urology and urogynecology. Wow, thank you so much for being here. Welcome to the program.
Thank you.
We're going to start. This is a pretty difficult topic for people to talk about, so I can't imagine that approaching someone like you is very easy for people. How do you break the ice?
Well, the good thing is most of the patients, when they're in the office to see me, they've already taken the step to schedule an appointment for incontinence. And so we're assuming they've got a problem, otherwise they probably wouldn't be there. So that is helpful. I don't know if it's good or bad, but talking about incontinence just sounds normal to me because it seems like everybody's got a problem to some degree. And the nice thing is there's things we can do to fix it. So just taking a matter-of-fact approach and talking about the things we can do to help seems like, I don't know, works at this point.
So do you find that your comfort level with it, doctor, makes other people comfortable with it? Or are you finding that it is kind of like pulling teeth to get folks to open up to you?
I think they're willing to open up to me. They're not always willing to open up to their family, their spouses. I find that a lot of patients really don't want to tell anyone or carry an extra set of clothing, but don't tell anybody that, you know, why they've got an extra pair of underwear in their drawer at work. But once they've decided they want help, they're usually quite comfortable talking about it.
Okay, thank you. And we have a diagram that we want to put up for our viewers, and it is of the bladder. So if you would please walk us through that. Tell us what's important to know.
Yeah, so there you see the bladder itself kind of in the middle, and the muscle that controls the bladder function is called the detrusor muscle. The ureters bring urine down from the kidneys into the bladder, and then you've got the pelvic diaphragm, the sphincters, and the urethra is the tube that drains the bladder and allows one to evacuate urine.
Wow, and doing research for this program, very eye-opening in terms of what can go wrong with the bladder, especially for those of us who fortunately don't have issues with that, right? So we're going to put up kind of a list of things and talk to us about kind of where we've been and where we are in terms of being able to identify problems with the bladder.
Yeah, there's a number of things that can go wrong, whether it be lack of support, where maybe the bladder's dropped, where some of the urethral support is compromised and somebody leaks with running, coughing, jumping, things like that. And then there's other issues like overactive bladder where people have to run to the bathroom and have a lot of urgency associated with their leakage. One important thing about overactive bladder is that not everybody actually leaks with the problem. It can actually be fairly common in men as they get older as well, which is surprising to a lot of people, but they tend not to leak as much as women, just given the difference in the length of the urethra between men and women.
Wow, okay, so November is Bladder Health Awareness Month. If folks who are watching remember nothing else about this program, what is the most important thing for us to know?
There's things we can do to help these problems, so seek help. And if you don't like the answer you get, then ask to see a specialist. A lot of these problems can be treated by family physicians, primary care providers, But there's times, especially when surgery is involved or somebody's failed more conservative measures, that it's important to see somebody who kind of specializes in taking care of the more advanced problems.
And how do they find that? I think it's one thing for, and again, you admitted you've been doing this for a while, and it's a very comfortable topic for you. But so if someone's having concerns, they're having issues, they don't really want to talk about it, how do they know? What's their starting point with a topic like this one?
I think a lot of times what happens is it's an oh, by the way sort of comment as they're maybe leaving their primary care provider's office. And so it's hard as a provider to spend a lot of time discussing and evaluating a problem when the patient's kind of on their way out. But sometimes it's something where they can just ask for a referral. Another important thing is many patients with their insurance plans don't actually need a referral. So if they have the problem, they can essentially self-refer and call up an office and make an appointment. So in my office, we have urologists. They take care of incontinence in both men and women. And there's myself and another urogynecologist, and we focus on just the female pelvic health.
Wow, okay. So as we saw, 17 items on that list. Today we're going to kind of whittle it down to 2 or 3. We're going to start with the overactive bladder. And again, we have a diagram that we can put up for folks when we're talking about that. Go ahead and tell us a little bit about what's important to know about an overactive bladder.
So the important thing about overactive bladder is that it tends to be urinary issues associated with urgency. Not everybody leaks with overactive bladder. Some people get up quite a few times at night with the problem, and others it's more of a daytime issue. Usually we'll start with behavioral modifications, avoiding caffeine, avoiding carbonated beverages, things like that, or just kind of an awareness of if I drink coffee, I might have a little bit more of a problem, so maybe I drink the coffee in moderation. So some behavioral changes that aren't, totally devastating to one's routine in a sense. A lot of people think drinking more water is always better, and I see a number of women who, think more is better, and so then are consuming several liters of water a day. And what goes in must go out. So it's important to keep in mind that overactive bladder is urinary frequency and urgency, but it's not due, it's associated with more usually smaller volumes that are in the bladder, and it's, if you're consuming too much, you're going to have to go to the bathroom more.
And I'm so glad you brought up the whole water thing, because I really would like to talk about that a little bit more. That seems to be not really the end-all to end-all, but a solution to so much out there. Just drink more water. I can appreciate what you just said about, what goes in must come out, but what really is a good amount of water for a typical person to be taking in every day, and what's the consequence if they don't do that, doctor?
Yeah, so it's always a fine line. There can always be too much of a good thing. Usually about 2.5 liters is an appropriate amount for one to consume in a given day. But it's also important that it, if somebody's getting up a lot at night, maybe the time to drink that water isn't at 7 o'clock in the evening. Or I think a lot of people are in the habit of having a big glass of water with their pills. And so if you're taking some pills at night, maybe a sip is more appropriate than a full glass. When somebody has overactive bladder, it's kind of important to keep in mind moderation. And I usually tell people if they're thirsty, drink. Obviously we don't want people dehydrated or anything like that, but it's your body will tell you when you need to drink more.
That's very interesting. Okay, I want to talk about, before we move on, I want to talk about more in terms of treatments for overactive bladder. What are you seeing, and what are folks doing to get back onto the road of
of getting
health.
better.
Yes, yeah.
Yeah, so usually we'll start conservative behavioral modifications such as minimizing or eliminating the caffeine, the carbonated beverages, alcohol, things like that. Another thing is we'll have people work on their pelvic floor exercises. That can be helpful. It's amazing how many people think they're doing Kegels appropriately, but not actually engaging those muscles well. So sometimes we'll incorporate something called biofeedback or pelvic floor stimulation or physical therapy to kind of work those muscles appropriately. In fact, there's some people that actually do them incorrectly, and so it's important to, that they be done appropriately.
Okay. You said a word in there, Kegels?
Mm-hmm.
Okay, talk a little bit more about that.
So often referred to as pelvic floor muscle exercises.
Okay.
It's when one contracts the pelvic floor, and oftentimes I'll tell people it's utilizing the muscles that one would use if they wanted to stop their stream. Now, oftentimes people think the best time to practice might be when they're on the toilet going to the bathroom, but that actually can cause a lot of voiding dysfunction where people then kind of have difficulty emptying their bladder ultimately. So those are the muscles one uses to do the exercises, but a better time to practice it is maybe when you're at a red light in the car, or just kind of getting into the routine of doing it several times a day.
So let me ask you something. We've been talking about water, we've been talking about caffeine. If folks aren't drinking enough water and they are drinking too much caffeine, at what point does that catch up to them? And how much does genetics and things like that play into something like this? Because I know folks who don't drink a lot of water and do love their coffee. So at what point are we,
Depends
kind of
if your
walking a fine
bladder can
line?
handle it. Certainly overactive bladder where people leak, that's more common in women as opposed to men. There are some genetic predispositions. Certain ethnic groups have more overactive bladder as opposed to stress incontinence, and we don't really know why, but there definitely is a genetic, a role for the genes when it comes to incontinence.
So maybe if that's what folks are doing, maybe they should turn the corner sooner rather than later so that they don't and aren't introduced to that problem down the road. Okay,
Yes.
All right. Let's go into the second, stress urinary incontinence. So define that for us.
So stress urinary incontinence refers to leakage associated with increased pressure in the pelvis. So oftentimes I'll find that people who have stress incontinence leak with coughing, bending, jumping, running. A lot of people think, oh, that's just that normal type of incontinence you have after you have a baby. And the important thing to take away is it's not a normal part of life after having babies. And if one has that, then it's important to seek help.
Okay, and what are we looking at here, Doctor?
So we're looking here, a picture of the kidneys and the ureters and then the bladder down at the bottom of the screen. And then below that is the urethra. Stress urinary incontinence often results from lack of support of the urethra. So when that kind of gets out of place and the ligaments that are designed to support that aren't working well, one often will have leakage with activities like coughing, jumping, bending, running, things like that.
Okay, and this kind of stuff, I think for some people, especially if folks are somewhat in denial, right? And it is something that they don't want to talk about. Really bad combination, right? What are some of those initial signs that someone, and we won't jump to that they are having challenges, but that they may have challenges, just so that viewers at home, if they are experiencing some of this, we don't want them to, again, jump to conclusions or get too fearful or go overboard with it, but what would be some of those things that we might want to be watching for?
So oftentimes, I think of when something that signals that incontinence, it's time to fix incontinence or urinary issues, is when people stop doing things socially or things that they love. So if grandma doesn't want to go to church anymore, and that was kind of her outlet for social activities, and that was always something she loved to do, sometimes it's worth figuring out why she doesn't want to do that anymore. Maybe it's because every time she stands up or halfway through the sermon she has to run to the bathroom. Then that the leakage may be playing a role in her not wanting to engage in activities that, bring her pleasure in a sense.
Okay, so this is where I'd like to talk with you a little bit about how do we broach that topic, especially, well, I would imagine people of all ages, it's difficult, but in the older adult, there's always that dignity factor,
yes.
no matter who you
yes.
are. And so we as family and friends want to be sensitive, but if we don't understand it ourselves, it's hard to broach that with somebody in a way that's going to get them to want to admit and open up about it. So what do you suggest, especially to caregivers, family members, if they suspect that something is going on? How do they approach that older adult?
I think just telling them that there definitely are options out there that can improve their quality of life, and let's involve an expert. Let's talk to your primary care doctor. Let's do something about it, because if you don't do anything about it or don't bring it up with anybody, how do you get better?
Yeah, and you're right. There is that, and I bet we all know somebody now as we're listening to you thinking, oh my gosh, they did stop doing that, or they opted out of that trip, or they didn't want to. So you're saying it's okay and you need to approach a professional about it.
Yes.
Okay.
Yep.
So when it comes to this stress urinary incontinence causes, I know you've said a little bit about, is there anything that you wanted to add in terms of what causes this particular challenge?
I think pregnancy and childbirth are the number one and number two reasons. Okay. Nobody tells you that that's really a risk of getting pregnant and having deliveries. C-sections can certainly minimize that risk, but definitely doesn't prevent it. And so it's very common. It often results in people not wanting to do things that are healthy, like exercise or be out playing with their kids, or a lot of ladies will say, I just want to be able to run after my kids, or maybe jumping on the trampoline might be a problem, but you can kind of avoid that. But it's nice to be able to do things that keep you healthy and keep you running with your kids.
So doctor, is it if you have one child, you're less likely to run up against something like this than if you have 8, or do we know people who've had 8 children and they don't deal with this issue, but the one who had just one does?
That is very true. So certainly the more trauma there is to the pelvis with more deliveries and such, that certainly can make the problem worse or predispose a little bit more, but there's a huge spectrum. I've got some people who've never had children who have stress urinary incontinence, and it probably goes back to genetics.
So I was going to say, so who is at greatest risk then? Is it just kind of across the board, or how do you get folks to recognize who might be at risk here to be watching for these
Pretty
factors?
much anybody's at risk. If we had a great way to predict who was at increased risk, we might be able to give better recommendations on what's the best mode of delivery for an individual, but we don't have that information at this point.
Okay, so I need to ask you have somebody come in, especially a new patient, somebody you've never met, and they're talking about some of the things that we're talking about today. How on earth do you get to a diagnosis? Because there could be somebody coming in who has a challenge, but maybe they're experiencing some other things too. And maybe you will direct them accordingly to a different professional. How is something like this actually diagnosed then?
So a lot of it is based upon history and physical. And so I utilize a number of questionnaires in my practice where I can at this point just kind of glance at how somebody answers them, and that kind of gives me a good idea of what direction to go. So as far as incontinence, if somebody says, every time I'm running to the bathroom, if I just had like 5 more seconds to get my pants down, I'd make it. Or like at night, I get up and even before I make it to the bathroom, I'm dribbling along the way. Those things kind of make me think that's more overactive bladder. I see a number of people from smaller towns throughout Nebraska, and it's funny, if somebody knows, where every rest stop is between here and Grand Island or Hastings, that is a little bit more consistent with overactive bladder as opposed to stress urinary incontinence.
Okay.
And so history and physical is the mainstay of the making the diagnosis, and on the when talking about physical exam, I do a pelvic exam on everybody and look at the support of the urethra and the bladder. And some people, their bladders may have dropped. Other people's, maybe they're just lacking a little bit of urethral support. Other people, their pelvic floor strength is compromised. Oftentimes I find with stress urinary incontinence, there's usually a lack of support under the urethra. And then with overactive bladder patients, oftentimes their support is excellent and it has nothing to do with loss of support.
So you said something in there, history and physical, which would imply then that people should be going to their doctors on a regular basis, because you as a physician want to see something that is most current. If someone comes in and they haven't been to their physician for 10 years, obviously makes life a little more challenging for you, correct?
It does. Well, and you learn a lot by actually looking at the part of the body that might be having problems. And it's nice to, you know, I don't know that everybody enjoys having a pelvic exam, but, you know, if it gets you the right diagnosis and then the right treatment, then it's probably worth having done.
Okay, let's talk about treatments when it comes to the stress urinary incontinence. Let's talk about what's available, because we really have come quite a ways in this particular area. So talk about treatments.
Yeah, so treatments, a lot of people will manage the problem with pads and things like that, but I don't look at that as a treatment. There is a new device on the market. It's available at just over the counter. It's called Impressa. It's a little tampon-like insert that goes in the vagina and provides a little support behind the urethra. And so if somebody's going to go run a 10K and find that they leak, you know, with that, they could use that in that situation. Or they could use it on a daily basis if they so choose. Another option is a pessary. It's a little device that one would get fitted with a physician or nurse practitioner. And that'd be something somebody inserts into the vagina when they're going to be doing physical activity that causes leakage, or some patients will wear it all the time. So those are kind of some conservative therapies. We recommend physical therapy for a lot of patients to work on the pelvic floor exercises. There is a vaginal laser that we can use to improve some of the collagen in the pelvic area. That some early data would suggest that that can be a helpful option. Probably the most common surgical procedure I perform for stress urinary incontinence is a sling procedure. I think a lot of ladies have seen maybe some bad press out there about with lawyer ads and things like that that might make them think slings are not the best thing out there, but it can be a nice option for the right patient.
Okay. When you're talking about all of those, what are we talking in terms of cost? How much of that is deemed necessary and may be covered by insurance, right?
Well, the nice thing is pretty much all of those options, aside from the vaginal laser, are covered by insurance. Well, they're not, this isn't a life-threatening condition. It's deemed as medically indicated or necessary. So insurance does cover the surgeries, medications, in many situations, the physical therapy and pessaries and all those things.
Okay. And I know we've touched upon it, but what else is important for us to know when it comes to the urinary tract infections?
Yes, urinary tract infections. Yeah. Big problem for a lot of people. So some people are predisposed to urinary tract infections, and those people probably should drink a little bit more water, and that can be helpful. In the postmenopausal group, my opinion is that using some vaginal estrogen can be very helpful to keep the pH or the acidity of the vagina more in the premenopausal state, and that can really be beneficial for minimizing urinary tract infections. Some ladies find it associated with sexual activity, and so just being aware of that can be helpful. Kidney stones can contribute to it. So there's a number of things out there, but if we had a cure for that, I don't think we'd have to be working.
And we talked a little bit about the older adults, and in just the minutes we have remaining, signs that they I think mostly about the people who can't speak for themselves, signs that there might be a UTI, especially in that population.
Yeah, blood in the urine, painful urination, worse urgency frequency. There can always be mental status changes that can play a role. I think one of the hardest things with dealing with urinary tract infections in the elderly is figuring out, are they somebody who's colonized, meaning always have an organism that is populating the urine but not the cause of the mental status changes or other medical changes, or which of those patients is the organism that's populating the bladder and urine really the main cause of it. And in those, it's important to treat. But it can be a fine line, and it's challenging because one doesn't want to overtreat with antibiotics and then build up resistance and not have antibiotics available when there's another infection, but get the problem treated. So it can be challenging. Big problem.
So in the minute, and we do have about a minute left, if prevention, so the best things that we can be doing for ourselves today to not necessarily eliminate but try to avert.
Yes, yes.
What would you say to us?
Be proactive about doing pelvic floor muscle exercises or the Kegels. If you feel like things are out of place or dropped, or if you have leakage, I think getting help early is really helpful, and being more proactive instead of waiting until things become a big problem, because we have really nice treatment options. Not everything has to be a surgical procedure. We can start very conservatively, but if the problem's treated when it's mild, I think it's much more fixable.
Wow, okay, so we do have a graphic that we want to put up for viewers in the event that they would like more information. We would want them to go to, and of course again, Bladder Health Awareness Month, urologyhealth.org. And doctor, just briefly, how do people find you?
My practice is adult and pediatric urology and urogynecology. Myself and my partner, Dr. Emily Kane, are both urogynecologists. We're board certified in female pelvic medicine and reconstructive surgery. And then we have 7 urologists who we're in practice with, and they all focus on this problem also. So our practice is over on off of 680 in Pacific in Omaha. We also have a location in Council Bluffs. So that's where the physical practice is, and we've got a website as well.
Well, thank you so much, and thank you for helping us get this conversation started. A very important topic, and we hope more people join in on the conversation.
Great.
Thank you very much.
Thank you.
You bet. And thank you all for watching.
Consider This is an issues and information program produced by UNO Television. More information can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours, or email us at considerthis@tvmail.unomaha.edu.